inflammation and mental health connection. So are you ready to start? If you're ready to start, write RTS in chat box. I'm looking for participation from you guys. So what is inflammation? Inflammation is the body's natural defense mechanism to fight infections and heal injuries. One is acute inflammation. Second is chronic inflammation. Chronic inflammation is something that is related to mental health disorders like depression, anxiety, schizophrenia. How? I'm going to explain this stuff to you. So acute inflammation is allergic inflammation, chemical irritants, infection, fever, trauma, burn, like that. And when this acute inflammation is not able to get resolved, it turns into chronic inflammation like chronic diseases, rheumatoid arthritis, autoimmune diseases, neurological diseases, cancer. And do you feel that this chronic inflammation has something to do with brain? How many of you feel like that? This chronic inflammation has some connection with the mental health? Yes. This chronic inflammation, it could be because of any chronic infection, dietary issues, chronic toxin exposure, autoimmune issues, chronic autoimmune diseases like rheumatoid arthritis, anything which is increasing inflammation in the body, any chronic disease, inflammation, it can result in mental illness. Now the question is, our standard model, it works on psychotropics and counselings. How it gives benefits when the cause is inflammation. Understand the psychotropic medications, they also reduce inflammation to some extent. But when they are not able to reduce inflammation properly, sometimes clinicians are increasing medication and it turns up into side effects. So one thing is very much clear that this inflammation, this can come from infection, chronic infections, by processed food diets, chronic toxin exposure, autoimmune issues, anything, whatever it is, the cause of inflammation. It can result in autoimmunity, it can result in mental illness. The stress and trauma, it also is correlated with inflammation. So, this inflammation affects mental health. How? Chronic infections results in immune system dysfunction. When somebody is having brain issues like psychiatric disorders, depression, anxiety, OCD, schizophrenia, people blame themselves. Do you feel that the stigma is helping them? Or it is causing more immune system dysfunction? So if we are labeling these disorders, that these are inflammatory disorders, will it be able to help in reducing inflammation? Because stress also increases in inflammation. If someone is coming to someone's clinic and the doctor is saying this is something in your brain, you are thinking like this, you are overstressed, and rather than somebody is talking like that, oh, cause could be inflammation, where from this is coming, we don't know. It could be stress, it could be unhealthy diets, it could be autoimmune conditions. Just labeling people that this is chronic inflammation can reduce the stigma, can reduce the stress and trauma, because even the stress, long-term stress, it increases inflammation. So I just want to convey this message. There is a dance of many factors that are going on. It could be chronic infections in the body, it could be chronic diseases, it could be hormonal imbalances, autoimmune conditions, stress, unhealthy diets, but inflammation. Now let's go to this pathway. This is brain, and suppose, this is our adrenal glands, stress is coming, HPA axis is involved. These all is also connected to your immune system, cytokines, macrophages, monocytes, vagus nerve. So even if there are no chronic infections, even if there are no chronic toxin exposure, no hormonal imbalance, only stress is also coming. This long-term stress also leads to inflammation. So if somebody is labeling someone that this, okay, I face stress for 7 months and after that I'm having some depression, anxiety issues, This is only stress which is responsible. Rather than talking about the inflammation, it reduces someone's stress. That, okay, inflammation is the cause and we can work on inflammation. So what is the integrative or functional medicine approach for the inflammation? It's a holistic approach which tries to find out whether chronic infections are the causes, dietary habits is the cause, hormonal imbalance is the cause. So this is an approach where you are trying to combine conventional medicine with integrated strategies to heal the body and mind. So this is something, a personalized care tailored to each individual's unique needs. So how functional medicine reduces inflammation? Suppose some patient is coming to a clinician clinic and somebody is having, gut health issues, hormonal issues, some inflammatory markers are raised. How this is helping? The most important thing is anti-inflammatory nutrition that is focused on whole and unprocessed foods, include omega-3 foods, gut health support, probiotics and prebiotics, avoid foods that irritate the gut lining, managing stress. No doubt, somebody is managing stress by any method, mindfulness, meditation, yoga, doing some spiritual practices. It all reduces inflammatory markers. Targeted supplementation like curcumin, omega-3, vitamin D3 to support anti-inflammatory pathways, personalized testing, that can be done. What are the chronic infections responsible for? What exactly is the cause of gut dysbiosis? Whether gut is hyperpermeable or not? Hormonal imbalances are there or not there? So that is trying to figure out what exactly is the cause of inflammation and reducing inflammation with generic things. So this part is clear. I feel so far that inflammation gets increased because of the chronic infections, chronic toxin exposure, gut dysbiosis, hormonal imbalances, hyperpermeable